The latest complaint by opponents of the president's health care law centers around a plan to have government-hired contractors check up on doctors' offices by scheduling or trying to schedule fake appointments. Correspondent Shannon Bream has details. Good evening, Shannon.
Hi, Brett. Well, here's how the program would work. The government would have people, actually paid contractors, call doctors' offices pretending to be potential patients and explain that they have either private insurance or that they participate in some type of government program, Medicare or Medicaid. First, they'll determine whether or not the doctor will even accept them as a patient, and then second, find out how long they'll have to wait to get an appointment. The administration says it's all about uncovering what's behind the shortage of primary care physicians and that this kind of study isn't anything new.
It's also important to know that this is a practice that has been engaged in by a lot of previous administrations, including the most recent one. President Bush's administration did this while it was looking at Medicare Advantage.
The fake calls will be made to more than 4,000 doctors spread across 9 states. Some of the physicians will get follow-up calls in which the callers will say they're calling on behalf of the U.S. government. Then data from the 2 sets of calls will be compared. Some skeptics think the program is all about scaring doctors into taking on less fiscally attractive patients.
It's clearly creepy. I mean, why is the federal government spending $350,000 on some kind of James Bond spy program? The real problem is that doctors don't like the impositions that the government makes in terms of payment, practice, and process when you deal with the government, when you take Medicare and Medicaid patients. And if they want to address this issue, what they should do is try and fix the problem rather than spy doctors.
The program is not yet a done deal, but if it gets final approval, the calls should start this fall. Brett?
Shannon, thank you. The local sheriff